Welcome back to another episode of the Lifescience Professional Podcast. I'm your host, Linda Robertson, and I'm happy to have our guest today, Paul Podstawka. He is a sales professional who got into the medical device industry without any sales experience. He'll share with us what his experience was like trying to get into the industry. He was a professional volleyball player, and after that was a teacher who then got into the medical device industry. So please help me welcome our guest today. Well, Paul, it's great to have you. Thanks so much, because I know we've gotten to know each other over the last couple of years and had lots of conversations about your background. And so if you don't mind sharing a bit about yourself with our listeners, that would be fantastic.
All right, awesome. Thanks, Linda, for having me on your show here today. It's a pleasure. I'll give you kind of go back in time a little bit and kind of take you through where I am today in my medical career. So starting back when at a young age, I was an athlete growing up. My brothers and I were competitive athletes, and I got into Team Canada for beach volleyball. So from my competitiveness, I knew there was going to be an end game where I'm going to need to get a real career and can't be playing beach volleyball my whole life. So I wanted to go into teaching because I thought the two of them married together would be a great combination. So teaching, coaching, and athleticism kind of was in the family, in the works. And I was a teacher for about 10 years before I even considered going into medical sales. But actually backtrack that, I went to university and played all my careers at York University. Then I went to Mac University, and then I went to Nipissing to get my education degree. And then I finally found teaching. And as soon as I was kind of on my end of teaching, I was kind of getting bored of teaching, actually. To be honest, I didn't get that competitiveness. That's what I was losing in the teaching environment, that I was kind of going to work every day doing the same job and getting paid the same amount as everyone else. And I was coaching and I was competitive and I was doing everything I could for the school systems. And I needed something else because I was missing that edge and I didn't have that competitiveness in the teaching side of it. So I got into a small startup medical device company, and I was with them in the surgical sales. We can talk about that later on in the show, but just to give you a little snapshot, I was there for 4 years, and fast forward now, I'm in a new company, and I'm a neurology specialist, and I have a young family. I got 2 kids, a boy and a girl, and a beautiful wife, and I'm here today with you, spending some time. Excited.
Fantastic. Well, I know, talking to you, and especially when, we met when you were in a smaller medical device company and trying to figure out sort of how to go from there to a bigger, more specialty role, and meeting you and talking to you, I was inspired because, your journey was a tough one. So I'm anxious to share that with the audience. So, talk about your journey a bit, going from, volleyball player to teacher, and what it was like to break into the medical device industry. Because, just talking about it now, if somebody's listening, they think, wow, I can do that. That wasn't so difficult. Well, it was, right? And you did a lot of banging on doors, but, and being competitive, you did touch on that, but your motivation to go into medical, why medical?
Okay. Well, here, I'll get you into it. So I didn't take the traditional route. I didn't go into selling B2B, whether that's like the photocopiers and printers. I went straight into the medical device sales, which is not your typical route. So I had to do a lot of networking with past friends who have been in the business. I got a LinkedIn account. I got a recruiter like yourself. And throughout the whole journey, there's steps involved, but it's very difficult. Like from my first time getting into it to now, I'm learning along the way what needs to be done to get into medical sales. But from the way I got into it, the original company that I was part of, they took a chance with me. And I was going out there trying to hunt for that next opportunity, and I was able to get that position. But it is challenging. And when you get into medical sales, I guess like the biggest thing is when you're a rookie or you're an entry-level medical sales rep, the biggest challenge for me personally was time management. How are you going to see all your customers, learn about your customers? How are you going to do your day-to-day in a medical sales aspect to utilize your time throughout that day. Now, I also wanted to mention that getting into the medical sales industry was a passion for me because I love technology. I love the aspect of it evolving, and I can see it in the time I've been in it in the last 5 years. I've seen technology evolve, and it's been evolving forever. So getting into medical sales was something I had a passion for, the healthcare system, and seeing technology grow to help improve our society and everyday life.
And that's true, right? It is an industry that has lots going on, lots of changes. You've been in two great companies with, lots of products and technology, as you mentioned, but, the challenges that you faced, as an example, just getting into the industry without sales experience, and you hit on a good point. You didn't go to the B2B, you didn't work for Canon or Xerox or any type of sales for that matter. You weren't in pharmaceutical, you didn't have a related experience to sort of transition. So what were some of the hurdles that you heard from people, even reaching out to some recruiters? You probably found that they don't want to invest in helping you get into the industry, or people said no. Like, what were some of the things that you came across, and how did you overcome that? Like, what were your responses to that? Because you're a very tenacious person. Yeah. You're meant for sales. Like, I know working with you, you were great. You were follow-up. Like, you did whatever you were coached to do. So what were some of the hurdles you encountered?
Well, if you're trying to get into medical sales, like myself at the beginning, everyone's going to say, no, you're not going to get into it. You have to do this. You have to go here. You got to have some experience. You need to have a little bit of experience so they can hire you based on experience. But I didn't have the experience. So I had to do everything I can to sell myself, get in front of that hiring manager, get in front of the boss of that company, and be able to show them that, yes, you're going to take a chance with me, but this is what I bring with my competitiveness, my ability to coach, my ability to learn, and be able to kind of transition into that role and grow as a sales rep for that company to help their company be successful, and for myself to be a successful sales rep within that company. So going back to the hurdles, is everyone's going to tell you no, but you just have to keep, like you said, following up with every single company, every single hiring manager. And then you have to do things outside the box. Like, how are you going to set yourself apart from the next person that's hiring? What are you going to do to better yourself, to make yourself look better? So, like, giving you an example, if you want, like, I've done a 30, 60, 90 day plan for the company, what my entry looks like for that company. So they want to see that. Why do they want to hire you? You have to come up with a good reason why they want to take a chance with you. I know my day one, when my boss told me, he gave me a weekend to think about it, and he says, tell me on Monday, why do I want to take a shot with you when you have no sales experience? So I had to come to him with a good presentation, a good idea of why he should be hiring me, and he took a shot with me. And then, long story short, I was really successful in his company, and even to this day, that we're still very good friends outside of work.
And I think your point is very clear, and anyone listening who's trying to figure out a way in, it's not just applying to Indeed, applying to LinkedIn, just sending your resume. I get resumes sent to me all the time with, I want to get into the medical device industry. Here's my resume. That's it. I'm not even going to look at their resume. It just doesn't make any sense. My time is valuable. And the people, though, that I do listen to are individuals like yourself who, reach out with a compelling message, or they've been referred by somebody, or they're differentiating themselves. They follow up with a phone call. Like, they're not just sending one message, they're sending a lot of messages, right? It's 7 or 8 touch points that you have to make. And it's that persistence, the consistent persistence, right? That gets you looked at. So I think that's, I remember talking to you and, having that conversation about how you related being an athlete and, all of the things that you had to do in terms of, making sure if you didn't train and if you weren't consistent to keep moving forward, you never would have made it as far as you did. You wouldn't have been on the Olympic team, right? And
Correct.
So all those behaviors and things that you did there, translated into you being successful to get your first job in medical, right?
Yep.
And that you use that to sell yourself as well in front of, your first hiring manager.
Exactly. Selling yourself is first. That's the only way you're going to get in front of your hiring manager. Sell yourself, then you can sell your product. If you can't sell yourself, no one's going to hire you. So
right. And now that you've worked for a small startup company, and with a small startup company, I'll just differentiate for individuals that are listening that haven't worked in a small compared to a large company. But a small startup, you didn't have a lot of resources. As you know, it was small, lean and mean. You know, you didn't have the sales training, you had product knowledge training. So you had to do what for yourself? What kind of training and support did you do to make sure you were successful?
Well, in the startup company, I guess, like you said, training is very minimal. It's kind of like you're gonna go out and you're gonna make mistakes, and you'll learn from them, because that's how you're gonna get trained in a small company. You'll learn about the product, they'll give you all the knowledge, all the tools, but in order to sell it, you're gonna have to start learning how you're gonna sell it. So you're gonna, like, for myself, I started reading some books. I went on websites, I was listening to podcasts, I was looking at YouTube videos, how to become a better medical sales rep. So I was doing a little bit more educating myself during that time, because I wanted to be an expert and the best in my industry. So I had to do extra things because I knew I didn't have it from the company side of it. So I had to go outside the box and start training myself to be the best rep I could with all the product knowledge that my company's given me. So that's kind of from the startup side of it. Do you want me to touch into the new company, or do you want to?
So let's bridge over now to the bigger company, right? So all of a sudden you've got the infrastructure of marketing, quality assurance, HR, sales managers, lots of other team members to work with. Big difference, right? And you have onboarding, you get hired, you have onboarding, they do product knowledge, they do some sales training, you got a large, robust CRM, like all of those sorts of things, right? What's the difference there?
Yeah, look, you touched on it. You get a lot more hands-on experience, a lot more training from everybody. I think the biggest, difference for me was the team members. Going from like a 5-staff team member to there's over 150 staff members within the company, but I personally work with about 25 of them. And that's kind of like my team on a day-to-day. I can talk to any of those 25 at any point during the day. So that's a big difference. And I enjoy that part of it, because that's what I was missing when I was in volleyball. I had a whole team aspect, right? So we had coaches, we had trainers, we had athletes, and we had teammates. So I didn't get that in my startup, but now I have that. So that's kind of new. That's refreshing. It's nice to have now. And then, like you said, all the training within the bigger companies, they provide you with the onboarding, the product knowledge, the sales knowledge, and then they get you prepared. So when you step into it, you get your feet wet. You're not going out there and making mistakes like you would in a smaller startup company, right out the gate. So they kind of better prepare you for the next step. So when you're out knocking on doors, you know what to do.
But what's the commonality though? You know, the smaller company, you've got less support. One thing that, I've worked for smaller startup myself, that I really liked about that is you learn. It's like, it's that you have to learn, right? And nobody's going to hold your hand. So you become expert and you learn lots of facets. You have that opportunity where, you get to learn parts of the business you don't necessarily get to learn with a large organization. It can be much more agile, right? It can move faster, think faster, be faster sometimes, because there's not as much bureaucracy in a smaller company. That's the pros. That, the not so much pro is not having that team like you're talking about, and maybe not having the robust product line, et cetera. But when you're with a larger organization, things can move a little bit slower at times. Right. However, you can have bigger product portfolio, you can have lots of new products coming down the pipeline, et cetera, right? But the thing that is common in both that I see sometimes candidates miss, or individuals I'm talking to, is the commonality there though, is both companies, you have to work to be successful. Right? You own the business, you own your own responsibility, and you're always sharpening your saw, right? Learning and developing. Because I know talking to you in this new role that you're, sometimes will ask me questions, or you'll tell me about things you're learning and things that you're doing. So, that's part of your personality as an overachiever, obviously, right? Comes from being a high achieving athlete. You're not going to stay idle, but it will also, translate into the money that you make, translate into the career opportunities you get down the road. It will help you be successful. So, what are your further thoughts on that?
Well, I think it takes a certain individual to be in the medical device, because you have to be a grinder. You got to be out on the road trying to knock on as many doors as you can, prospect new clients, new leads, and then close on those deals. And then a good sales rep can do everything from prospecting to closing to managing accounts, and being able to use their time wisely. So, and I think like in the startup world, if you can't take no's, then this is not for you. You got to be able to go out there, make mistakes, because you're going to grind it and you're going to make some mistakes along the way, but you got to learn from your mistakes. I always told myself, don't make the same mistake twice. So if you mess up once, you learn from that and you just don't do it again. So I've learned a lot of mistakes throughout my career in medical sales, and I'm enjoying every part of it.
Yeah. And so in terms of your development, when you first started, you were learning product knowledge and teaching yourself sales. What do you find that you're continually always developing no matter what?
Well, I think you're always developing your sales skills, your pitches, being able to present in front of customers, your demos, doing everything from like the start of the sales pitch, moving all the way to closing a deal, being able to be part of every single sales process along the way. So you got to keep sharpening your skills every day and being able to stay on top of that. So like in my role right now, it's more of like a senior sales leadership role, where I have a lot of junior reps that I'm working with within the company, and I'm helping them and kind of guiding them of what needs to be done, how to go out there. I'll go with them and we'll go knock on doors together. I'll show them by example, and then I come help close the deals and we get business for the company. So that's kind of where I'm at in my career right now.
That actually leads me to the next question. So, being a teacher and coaching in sports as well, how has that helped you, in your current role?
Well, the biggest thing is for me is a couple things. Learning. I think as I'm going through my career, I'm always learning. So as a coach, I was always learning. As an athlete, I was always learning. As a sales rep, I'm always learning. And now in this position here as a sales specialist, I'm still always learning. I think being a learner, everyday learner, is very valuable. And I'm still very competitive. I think being competitive is something that all sales reps need. And I know that like everyone's going to say, oh, I'm motivated, I'm driven. And those are things that hiring managers are looking for. But at the same time, how can you give examples of those situations of being motivated, being driven? Because they all hear that. Everybody knows those are the buzzwords. But what are you doing to differentiate yourself and being able to put yourself out there and make yourself different? And I honestly think that being competitive and communicating and showing your team leadership within your team is very valuable.
What's interesting you say that, because, when we're interviewing candidates, doing our recruiting, and we're asking them those questions, like they'll say, oh yeah, I'm really, I'm driven, I'm motivated, I'm a high achiever, and this and that, the buzzwords you're talking about. And when I'll ask them, can you walk me through examples of, situations, or, what have you accomplished in your most recent role, your last 24 months, They often can't tell me. They can't give me examples. Or I will also look for other ways to test that. So I'll say, in preparation for your interview, what sort of research have you done? As an example, right? So it tells me how thorough, how interested they are and driven. So if they really want the job, have they researched the hiring manager? Have they researched the company? What do they know about the products? Like, how much do they dig in? And it's to your point about, you like to learn. So it's also your ability to learn. Mm-hmm. So some people, they're always think they're taking courses, they're always online, but they don't absorb the information, right? And in the medical device industry, you need to be able to absorb the information, because it's a highly technical industry. In most cases, that is. The products are technical, and they're always evolving and changing. So I look for candidates that, I say, do they have the aptitude to learn? And do they have the right attitude, right? The ability to do the job? Or do they have the drive? Those sorts of things. And a lot of times the candidates, they haven't done the research. They kind of, well, you know what, I'm going to do some more work tonight. That tells me something about that candidate. because that's the way they approach the job in general, especially if they've been in sales for a while.
Yeah.
So, like the research that you were doing was like over the moon. It was like, oh my God, he's going to do it. Right. It's a bit of a different, but I also find, and this isn't just to toot your horn, it's the truth. We have found over the years, I've been doing this 22 years, as you know, often we've come across teachers who make very good salespeople, which is quite interesting, right? And I think it's their teachers that are interested in going into sales. It's their ability to learn. It's their curiosity, right? Drive. That curiosity that makes them want to know more, dig into things, because a lot of times it's that research. You've got to make that extra call, do that extra thing. You can't just be status quo, right? Athletes, but they're the top performing athletes, not the bench warmers, the ones that got red shirted. They're the ones that actually did achieve things. You know what I'm talking about? So that's what we look for. And, that's where I completely understand what you're talking about and how important that is. What essential qualities or skills do you think that aspiring sales representatives need for the industry that you've noticed since you've been in and now that you're interacting with junior representatives? What are the things that you have picked up on?
Well, I always keep going back to being that competitiveness. That's where you were saying, like, the athlete, because if you're not competitive, someone else in that industry is going to be competitive, and they're going to be out there hunting and going out door knocking and getting business for their company. So you need to be actively competitive so you can have that drive, that motivation, that passion to be successful within that company. And then I think communication, organization, because it gets really busy really fast. And if you're not organized, you'll get lost really quick, and your accounts will get all messy. And then you'll have a hard time trying to keep up and track who is who, where's everything going, where's this account, and everything gets messy. So if you're not good with your organizational skills, you're going to have a hard time in medical sales, because you have a lot of accounts, a lot of products, and you got to keep a lot of customers happy. And so in order to do that, that's just the maintenance side of it, not including the new leads that you're getting, the new opportunities, the networking. So I think some of those skills too, like the networking is big within the industry. Even when you become a sales rep, networking with your colleagues, networking within the hospitals or private clinics, whatever it is, you got to just keep networking. And that's how you're going to get business. That's how you're going to grow as an individual. That's a very a good trait to have is the networking aspect of it, because I see that before you get into medical sales, networking, like you said, getting a LinkedIn account, finding the hiring managers, getting a hold of the hiring managers, find out some of the sales members, part of that team, trying to understand who's who on the team, and being able to do that. So networking is kind of a big thing, I think, for new sales reps, what they can do. That's a big trait to have.
Yeah, and you made a good point. So let's talk about that, a day in the life of a sales rep. And so just take an average day. So you start, and let's take not the day, but the night before, because if you wake up that day and you're trying to start your day, that's how it gets messy, right? So let's just say the night before, what would just kind of run through that, if you don't mind?
Yeah, so in surgical sales, let's be specific here. On every Sunday night, I would go over what my week's going to look like. I'm going to look at my weekly plan, my calendar, trying to find out where I'm going to go throughout the week, where's the new business opportunities, and where are my current accounts that I need to kind of facilitate. And in between, I might have some evaluations. So I got to manage all my accounts on Sunday to figure out where I'm going to go Monday morning. And then I know kind of where I'm going to go Tuesday, Wednesday, but that can all change on the fly. In medical sales, it's never going to be the same. Even though you might plan your week Monday, Tuesday, Thursday, Wednesday, whatever, to Friday, the way you want it to be on a Sunday night, but that might change Monday morning if you get an emergency call and you got to go to an evaluation at Sunnybrook Hospital, but you're going door knocking in Hamilton. So they might change, that might change on the fly. So certain things will change, but let's say I know where I'm going Monday morning. I plan my day on the Sunday night to figure out where I'm going. And then usually I'm up on the road by 6 a.m. in some account by 7 a.m. And if I'm in the OR, I'm changing scrubs and I'm going around with my product to different customers, whether it's a current account or a new account, whatever the case is. Obviously, if it's a new account, I won't have scrubs because I haven't met the hospital staff yet, but I'm just assuming I'm in the hospital and I'm going to my accounts 7 a.m. I'm trying to get new business or maintaining my business. That's where I'm going. And then throughout the day, I'm going to make some pit stops. On my way home, I'm going to try to find some new accounts on my way home. I'm going to make some phone calls, some follow-ups on my way home. And maybe on lunch, I might touch up with some emails and try to catch up there. And then you never know when your day is going to end. Because if you're in the OR, you might not come home till 9 p.m., but your day might end at 3 p.m. You don't know. So every day kind of it's a hit and miss with the surgical side of it in medical sales, because every day is different. Every day ends differently, and it can change on the fly. So you just have to be prepared for movement within your day and being able to change and not be set in stone with this is what I'm doing, because you got to be flexible. That's another, I guess, characteristic that a new rep needs to be flexible and be able to move on the fly, because you don't know who's going to call you, and try to knock off all those tasks during your day. And
then you have your laptop where you can enter in your CRM information, correct?
Yeah.
And which is important because, I know that reps, like I've had clients ask me, can you go out in the field, work with the team, see where the challenges are? We've got some gaps, And the reps that are very organized, stay on top of it, are doing that on the fly. Where the ones that say, okay, block off an hour at lunch or 1 o'clock, and then I'll do it then. Just to your point, and it doesn't matter if you're a surgical rep or just a medical rep where you're, selling other products not in the OR, like all the other sundries or specialty products outside, or it could be long-term care, or it could be aesthetics, anything like that. If you leave it to the end of the day or at lunchtime or wherever, you never know what can happen, to your point, right? And, that organization that you're talking about, it just collects and it collects and it collects. And before you know it, you're doing it on the weekend and you're not planning, you're not having a downtime, which can really affect your productivity and organizational skills, to your point, right?
So you got to try to stay organized throughout the day as best you can. And then even at the end of the day, overlook to see, make sure you put down in your notes who you saw, what were some of the comments, and just kind of keep yourself busy and organized at the same time. So the next day you got something else to do, somewhere else to be. So, and if you're working with a small team, then if you're on your own, you're on your own. But if you're working with a larger team, then you have to let everybody know within your team. And some of the larger organizations, we have pipelines, so we can see everybody's accounts, where they're at, what the notes are saying, when they visited that account. So we know that we're not going to double visit that same account if we're going through that same kind of territory, right? So we got to make sure that everybody's organized within the company. So
which makes sense, right? It looks like nobody's communicating when 2 or 3 people are going into the same account one day after another, so it's not very good.
Exactly.
And can you highlight some of the sales techniques or approaches that you've worked well for you in the industry? Anything specific?
Yeah, I think like the number one thing for like any sales rep is to try to find the customer's pain points. So you're trying to give them a solution for their pain points. You're not going in there trying to sell them on a specific product. You're trying to sell them on a solution for their problems. So you need to identify what are those pain points within that facility or for that doctor or whoever it is that you're trying to establish a relationship, and being able to solve those problems with the solutions you have available in your bag. And then trying to build those relationships with the customers, always like long-term building relationships, whether it's coming for a visit for a lunch and learn, or bringing them coffee or bringing the staff coffee, making sure everybody knows who you are, that you're in the house, you're bringing them something because you need to talk to them about something to help their problems. You're not just going there to pitch them on a product, to show them the bells and whistles of this product, but you also want to show them that you want to be part of being able to be part of the solution for their problem. And the customers love it when you bring that donuts or whatever. And then at the same time, the surgeons love it when you bring them new new technology, but also new studies or new papers that have been published. So they like to see that. So you don't always have to bring them a product. You can bring them papers that they can read, and just to show them that you're building this relationship with this surgeon or customer, whoever it is. So I think those are some of the big touch points in terms of strategies when you're trying to get in front of a customer. Obviously, there's going to be the gatekeepers that are going to be hard to get through, but you keep them happy, then you get to the end user, and that's kind of your goal. But along the way, you got to get everybody happy, making sure that you're bringing them solutions for their problems. You're not just trying to get to that end user right away. You got to kind of sweet talk your way all the way through. And yeah, so I guess at the end of the day, those would be my my tips for any new sales reps.
And it's really learning, what does work and what doesn't for the different individuals, right?
Right.
Because each region is slightly different too. So, what works at one hospital surgical area is different than another.
Yeah.
I know, it's always interesting.
And something else I wanted to add,
yeah.
I just remembered. So networking is big too, right? So when you're going into a hospital, let's say, for example, you want to know who's the chief of this division, who are the nursing staff, like the head nurse and the OR manager. You need to know who are the end users and some of the big titles within the hospital. And then you also want to know what are the big players within that hospital? Who are the other companies that you're up against? So you need to know what products are on the shelf. You need to do some digging and some researching as a sales rep, so you know what you're walking into. So you're not just going in there cold and trying to sell your product. You need to find out some of the other competitors' products. Find out, you got to be an expert on their products too, not only on yourself, your own products, but you got to be an expert on the other products too. So you know what you're up against, and then how you can help solve their problems, because you know what some of those other issues are within the industry.
Yeah, very good point. Absolutely. And, individuals who are passionate about getting into the industry, like yourself, no experience, what would you recommend are the first 2 or 3 things they should do? I mean, things have changed a bit since you tried. I mean, we've had COVID, we've had lots of policy procedure changes and so forth. So, anything different that you would recommend? I know you talked about networking, updating their LinkedIn profile, which I'm always telling people to do. What would you suggest? Anything?
Well, if anyone's new, recruiting is big. So you need to find a good recruiter like yourself, Linda. Go to Linda or Brad, talk to them about what you have, what your experiences are, what you can bring to the table, and then a recruiter will help you along the way. They'll help you with the interviewing process. They'll help you prepare for the interview, after the interview. So the recruiter is an essential tool, a coach that can help you break into that industry. So I think that would be number 1. Number 2 is prepare yourself. So obviously the interviews are going to be huge, but go to as many interviews as you can. Apply to as many possible job openings that you can find. Your recruiter will help you find some. You'll find some on your own. LinkedIn will have some job postings, and then do everything you can. Try to find that hiring manager. Try to find a team member and try to ask them questions and be proactive. That's the word we're looking for here, is proactive of how you can just continue to dig and be yourself and trying to outwork the next person to get that job. So yes, you got to go get a recruiter. Yes, you got to have a LinkedIn account. Yes, you're going to apply to 1,000 different companies out there, but start being specific of what you want to be involved in. Do you want to be in surgical sales? Do you want to be in dental sales? Do you want to be in aesthetics? Well, what division of medical device or type of sales route you want to go into, and then be an expert in that. So start listening to podcasts on it. Start finding podcasts on just medical sales reps in general. What are some tips and tricks? And start learning about that, so that when you go through that interview, you're very prepared. You're not walking in there cold. You know exactly what they're looking for, and then that's how you're going to beat out that other candidate. Those are just some of my tricks to some of the new rookies that are trying to get into the industry.
Yeah, no, I think it's fantastic. That's exactly right. Yeah. And looking back at your journey, what's been sort of the most rewarding aspect of that you have found along the way that you want to share?
Well, I don't think there's one aspect. I think every day in medical sales is a new day. It's a new experience, and no day is going to be the same. So I know a Monday is not going to look like a Tuesday. So that's what I enjoy about the medical sales industry, is that you're never going to walk in and have the same lesson plan every day of what you're going to do, because your day is going to change on the fly. You're going to have a meeting here. You're going to have to go see a customer. You're going to go see a team member. You're going to bring a product. You're going to do a demo. You're going to have so many different opportunities within that sales role to basically enjoy it. And I personally enjoy it. And then a really rewarding thing is helping others, like the technology side of it's great. But when we see that the doctors are helping the patients and you're kind of involved in that team aspect in the OR, you're part of that team. It's a privilege to be in the OR. So when I'm in the OR, I feel very privileged, because not many people can dress in scrubs and stand beside like a spine surgeon 2 feet away, and he's asking about your product, and you're going to help him out because you're helping that patient. And then after the procedure, he high-fives you on the way out and said, "Hey, Paul, that was great. I love your product. Thanks for being here. See you in a couple weeks," right? So those are some of the key like tidbits I get from it. And I like that part of it, when you're like, you can make that relationship with that surgeon, that you're involved in that surgical atmosphere, and that arena is something to be like inspiring. And I love that arena. I love the OR. And now that I'm not in the OR, it's still a great arena. I'm enjoying it. I'm with a lot of team members. I get to travel. I cover all of Ontario and all of Western Canada. So I get to go out to BC, Alberta, see new customers, see new reps. So it's a privilege, and I'm excited with my new role right now within this company, and hopefully I can continue to grow the business here.
Yeah, good for you. Well, I think you've inspired, I'm sure, some listeners and some new people considering it, because the industry's growing and companies are growing. So we need new people to come and join us in this fabulous industry. I've been in it a long time. I loved it when I sold and managed people, and I really enjoy bringing individuals to our clients. So, I really appreciate you being here, Paul. I'm sure that individuals enjoyed hearing what you had to say. So thank you.
No, thank you. This is great, because, it's hard to get into this industry, and not a lot of people know about this industry. When you're in high school and you're trying to find out a career path, and even when you're in university, you don't really know that there's a medical sales like pipeline that you can go down and be a sales rep and be in the OR and work with surgeons and do all that kind of cool stuff. So I enjoy it, and hopefully we inspired, and you continue to inspire others out there to get into the medical sales industry. So thanks again for having me, Linda. It was a pleasure.
You're welcome. Thank you.